Good morning and welcome to session 2 of our series on thriving with anxiety. Today is the second part of sort of the two-part introduction to thriving with panic and anxiety. And in today's session we're going to cover how do panic attacks happen, how does it develop, how is this maintained, how is the panic disorder maintained, and what can be done about panic disorder. And then maybe just making a suggestion to monitor your panic attacks, monitor the flow, ebb and flow of the panic attack. Alright, so let's get into today's session. So today, as we discussed in Module 1, panic attacks are surges of intense anxiety and fear. And in panic disorder, panic attacks seem to occur unexpectedly and they cause considerable distress. So what we're going to do is we're going to talk a bit about now how do panic attacks happen and sort of what triggers them. So in Module 1, we discussed again how a panic attack can be described as a false alarm or a spontaneous surge of fear without any real physical threat. And so one of the questions we often ask ourselves then is, why do panic attacks happen? Because often when I say to people, was there a trigger, they'll go, no, they just happened spontaneously. So anyone can have an initial panic attack or a false alarm for a complex mixture of reasons. And this mixture probably includes your biological makeup, your personality, or the tendency in your body, in all of our bodies, to initiate a fear response for a survival mechanism. So while these factors provide the setting for a possibility of a panic attack, one thing that often sets the stage is your experience of stress, any previous experience of stress. So many people recall that their first panic attack happened after a stressful period of their lives, such as a negative life event, or relationship difficulties, or a significant loss. And in people who have a greater likelihood of experiencing these fear responses, they go through this kind of stress can make a panic attack a lot more likely. So for more people then, their physical response to negative events might be similar to how they would respond to physical danger, and as a threat, in other words, to their well-being. So this sets off the panic stations. So at other times, panic attacks begin to build when there's an internal or an external trigger that's perceived as threatening. External triggers can be situations in which you feel a little apprehensive. For example, going into a room that feels stuffy, a small space, onto a train. Some people have them in supermarkets or malls because it can be difficult. It's a feeling that it's difficult to escape from them. And you can probably think of a few situations right now which, in your cases, make you feel apprehensive. And then these internal triggers can be thoughts, images, memories, even bodily sensations. And these triggers can be ordinary events until you interpret them as somehow threatening. For example, have you ever felt tightness in your chest or felt your heartbeat faster and thought, what's wrong with me? Which then leaves you feeling quite anxious. And remember, it's our belief that something's wrong with me or something's threatening us that leads to these anxious feelings. And so when we perceive a situation, a thought, an image, or a sensation as somehow threatening, we begin to feel more anxious and more apprehensive. So it's a sort of a spiral that goes up and up and up. We've often spoken about that quicksand metaphor as well, which sort of spirals us down into this pit of anxiety, and it starts getting a hold of us. So when we start to feel anxious, we might notice some physical changes, such as accelerated heart rate, shortness of breath, tightness in the chest, dizziness, etc. And normally these signs of anxiety soon subside or fade away on their own if the threat's not a real one. However, what do you think would happen if before these sensations subside, you start worrying intensely about the meaning of those sensations, such as thinking, what would happen if it happened again, or what would happen if I can't get away, or what happens if I'm having a heart attack, or what happens if I can't breathe? So we latch onto this, and in psychology we call this thought fusion, and this just, as I said, it just spirals out of control, and the panic starts taking a real grip. So you can probably guess that the extra layer of thinking produces a rush of increased anxiety, and this panic station's alarm starts going off. Now I'm having what started with mild anxiety has now become a full-blown panic attack. So think about it in this way. What would you think would happen if you started thinking that you were going to have a heart attack or going to faint? Your anxiety about these anxious sensations probably would increase, which makes the anxiety sensation stronger. And this increases your anxiety about those sensations, and so on. You can probably see where the situation is leading, and this anxiety would rise so quickly that a panic attack results. In the last series we did on mindfulness, we spoke a bit about automaticity and the automatic thinking and how thinking feelings go into the spiral of creating a bigger problem than it was originally to start with. So how do we restore the systems, or let's say after the panic attack, the restoration of the system? So once the immediate danger is abated, the body begins a process of restoration back to a more relaxed state. And as a result, the heart rate begins to slow, breathing rate slows, the body's temperature begins to lower, muscles begin to relax. However, the systems involved don't immediately return to this normal straight away. Sort of in primitive times, if a wild animal had been present, you would need to remain in a case of high alert. So the full restoration to a relaxed state takes quite a while. And this can leave the person feeling keyed up or wound up, or tightly coiled spring for some time afterwards. And this helps to understand why it is that people can feel anxious for ongoing periods of time when there's not even an obvious stressor that's present. So let's take a look at how does panic disorder develop. As we mentioned, many people have panic attacks, but it becomes a problem when you can't function adequately in your daily life due to the frequency and the severity of these symptoms. Now that we've talked a little about how a panic attack develops, I think we're going to talk a little bit about how that panic attack develops into panic disorder. And there's no simple answer, of course, as everyone's different, but there are some important factors that have been identified. And these can be identified or split into biological factors and psychological causes. So the biological factors, no single gene has been associated with anxiety or panic disorder, although based on twin studies and family studies, it does seem that individuals can inherit a vulnerability to developing an anxiety disorder. As we mentioned earlier, some people might be physically more prone to experiencing a panic or fear response, be it in response to a physical threat or a negative life event. Some of the psychological factors, having this vulnerability doesn't necessarily mean that someone will develop a panic disorder. A great deal depends on the person's lifestyle, type of life stressor, and their early learning. For example, perhaps as a child you were taught that certain changes in bodily sensations, such as those due to anxiety, were negative or dangerous. Or perhaps you learned that if you had such sensations, that you should rest or be very cautious about them. If you not had the opportunity to unlearn these patterns of thinking and behavior, they may continue to develop, contributing to your distress about your panic symptoms. So let's say that with these patterns of thinking and behavior, you now experience a false alarm. It's no surprise then that you might become more anxious and apprehensive about these bodily sensations. Panic attacks can be very intense, and when this apprehension about physical symptoms develops as well, a number of psychological factors can then also contribute to frequent and more severe panic symptoms. So we developed this idea called anxiety sensitivity or hypersensitivity to physiological responses. So when someone experiences panic attacks and is apprehensive about them, it can be easy to associate mild physical symptoms such as a slight increase in heartbeat with the possibility of intense panic symptoms, or believing that this symptoms might now signal the onset of a heart attack or that you were going crazy. And as a result, the person then becomes more attentive to bodily sensations as tightness in the chest, breathlessness, dizziness, sweating, because now they're worried about having a panic attack. They end up scanning the environment for any situation or sensation that can indicate a potential episode of anxiety in the hopes of avoiding it. This now obviously creates more tension and more anxiety and more stress, and the likelihood then of another panic attack happening is built onto that first one. So the situation is a little bit like a smoke alarm that's now too sensitive. It's ultra sensitive. It's so sensitive that its alarm system gets activated at the slightest possibility of smoke. In fact, it's so sensitive it basically activates the alarm when no danger is present. So if someone's cooking, or even when the hot air escapes from the bathroom. So something similar happens to a person who is anxiety sensitive. They continually find themselves becoming anxious, activation of the fight or flight response system, and at the slightest suggestion of threat. Just, I'm feeling hot, I might have a panic attack. I had one lady I worked with who, and exercise, one normally recommends exercise when one's struggling with anxiety, but the minute she got onto a treadmill, she would have a panic attack, and that's just because her heart was escalating, and as her heart escalated, this would trigger in her a panic attack. So we've spoken a little bit about the focus on internal sensations. So as mentioned, being sensitive to anxiety symptoms often results in the person scanning the environment for possible cues for anxiety. Often this means focusing inwards and noticing all the different physical sensations. By focusing on your own body reactions, such as sweating or trembling, it can be easy to convince yourself that you've got a physical problem, for example, having a heart attack, or a mental problem, for example, going crazy. This can start the panic cycle that we described previously, leading to more frequent panic attacks. So what's the end result? Well, there seems to be no obvious external reason for the panic attacks. They appear to be unpredictable and to come out of the blue. So they can also be very distressing because of the intensity of these symptoms, and because they're unpredictable, and because it's difficult to escape from places where they might occur. So as we discussed in Module 1, there are markers of panic disorder. So how is panic disorder maintained, and how do we manage to keep this disorder going? So once panic disorder develops, several factors contribute to the maintenance of this panic disorder. So firstly, anxiety sensitivity and the focus on internal sensations, which we've just discussed. So we've discussed how these factors might influence the development of panic disorder, but they also help to keep it going. The more a person learns that anxiety symptoms might signal an oncoming panic attack, the more focused they become on monitoring those internal changes. And perhaps by doing this, there might be adequate warning about the onset of a panic attack so that it can be avoided. So when people believe this, and they believe that these symptoms mean physical or mental danger, it's no wonder that they start scanning for signs of threat. However, we all have these normal fluctuations in physical symptoms over the course of a day, which means that even normal changes in physical sensations can be mistaken for the possibility of a panic attack or the potential for mental or physical danger. So it's the belief that those symptoms are dangerous that contribute to the ongoing distress associated with panic, and which might even make panic attacks more likely. Like I mentioned before, when I ask people how fast is a fast heart rate and someone says to be 90, I want to have a chuckle because the average heart rate is 72, and 90, as I said, does not even go into zone 1, and we have literally 5 levels of zones of heart rate when you're training. So 90 would not be considered a large heart rate or a very fast heart rate. Then there's avoidance. In that previous series, we've always spoken about avoidance creating a bigger problem. So many people who become distressed about the possibility of having panic attacks often avoid situations where panic attacks may occur, or activities that might trigger panic symptoms. So while avoidance of some of these situations can reduce anxious feelings in the short term, it also reduces the opportunities to prove to yourself that anxiety symptoms are not dangerous. In other words, avoidance prevents people from disconfirming their fears. So the more we don't do something, the more we tell ourselves we can't do something. It's like a phobia. The more you avoid something that you're scared of, the more scarier that object becomes. Then we also create a whole range of safety behaviors. So even if you don't fully avoid the situations where you think panic attacks might happen, you might go into these situations and behave in ways to minimize those anxiety symptoms. This is how obsessive compulsive disorder can creep in, where we have to check the door 3 times, for example, or whatever it might be to reduce our anxiety. So in Module 1, we talked a bit about how you might use these safety behaviors to prevent future panic attacks or symptoms of anxiety. For example, you might sit in the chair closest to the door to make a quick escape if necessary. Perhaps you do some breathing exercises to reduce your anxiety in the situation. In this case, although you're not avoiding the situation, you are avoiding the anxiety symptoms. However, in using the subtle avoidance, these safety behaviors, you never lose fear of your panic attacks. This means that you continue to worry about them and thus obviously focus attention on them. So what can be done about panic disorder? Of course, there's medication. So medication has been used to reduce anxiety symptoms and reduce the likelihood that you'll have panic attacks. And while there are a number of different medications that can help you to reduce your symptoms, it's often difficult to know which one will work the best. So you should always speak to your doctor if you have any queries about medication. And if your doctor prescribes them, make sure you follow all the instructions and report any side effects to him. Then we have CBT, or cognitive behavioral strategies. Another powerful treatment option for reducing these panic attacks is CBT, or cognitive behavior therapy. Cognitive and behavioral strategies address the 3 components that specifically contribute to panic and intense anxiety. And you might recall from Module 1 that these components include cognitions, behaviors, and your physiology, or what's going on in your body. So in this way, cognitive behavioral strategies seek to change the anxiety habits that might have developed into panic and anxiety. And on top of CBT now, we have mindfulness CBT, which I've been talking about, this mindfulness-based cognitive therapy. Then we have our thoughts, cognitions. So for people who experience panic attacks, cognitions can occur in the here and now of the situation and can include focusing on physiological sensations of anxiety and panic, and then interpreting them as catastrophic. Importantly, it's our perception of a particular cues that's dangerous, and this contributes to an increased anxiety. So these cognitions are also part of a bigger picture of thinking processes. People who experience panic attacks often worry excessively about anxiety symptoms, and they might overestimate the likelihood of having a panic attack and thus overestimate the consequences of having a panic attack. So it's this continued fear of fear that starts the feelings of anxiety, which then prompts the search for evidence of threat or danger. So in these modules, we're going to take a closer look at the types of cognitions and thinking styles that might contribute to anxiety and panic systems. We're going to start that from tomorrow's session. Then we look at the behavior. One of the most important factors that needs to be addressed when overcoming panic and anxiety is the avoidance of symptoms of anxiety. So avoidance of situations where panic attacks might occur, and the use of safety behaviors to try and prevent these panic attacks. So these modules are going to suggest some ways to gently confront the things that you're avoiding so you can start to feel less anxious about the symptoms of panic attacks. After all, if you didn't want to feel less anxious and panicky, chances are you wouldn't be watching this presentation now on the panic and anxiety. Then our physiology, or what's going on in our body. So remember that the physical symptoms that our bodies experience in reaction to anxiety are provoking events. And these included rapid breathing, pounding heart, sweaty, clammy palms, muscle tension. And for some people, changing breathing patterns can help to show that anxiety symptoms are not dangerous because they're under your control. However, we don't want you to just use breathing strategies like the calming technique as a safety behavior to avoid anxiety. And we'll talk about breathing techniques towards the end of this series. We want to first focus on experiencing those panic sensations so that you've got real proof that they're not dangerous. So then it's, like I said before, it's extremely important to monitor your panic attacks. I think what I'm going to do is probably put one or two notices up on my Facebook page. I've got a nice one called Riding the Wave, and there's also one called Monitoring Your Panic Attacks, which is a way of trying to assess what happens in the panic attack. So you know what's going on, you know how long each phase of your panic attack lasts, so that you understand what your triggers are, how you experience it, what's going on in your thoughts, what feelings are you feeling, and how your body feels when you're going through a panic attack. So you can identify it when it comes along. It's extremely important to monitor your panic attack. Alright, so let's just have a summary of today's session. So please remember, it's always important, this is just a warning again, to ensure that you first have your symptoms checked by a qualified health professional or your GP. And once you're sure that your symptoms are due to anxiety and not to any medical reasons, then the information in the rest of the modules can help you to reduce your panic and your anxiety about panic attacks and to help you thrive. So we touched on the following in today's session. Panic attacks are brief, sudden surges of intense anxiety with symptoms that are very similar to intense fear. Initial panic attacks or false alarms can happen for a mixture of reasons, including biology, personality, and stress. Panic attacks can be set off by internal or external triggers that the person believes is somehow threatening, and the distress about having these panic symptoms can create an increasing spiral of anxiety that builds quickly into a panic. The body has mechanisms to naturally restore itself to a more relaxed state. However, this process is usually slow and can leave the person feeling on edge for some time after the initial panic attack. Many people have panic attacks, but panic disorder develops when it interferes significantly in a person's life, and biological and physiological and psychological factors can influence the development of this panic disorder. Psychological factors include being sensitive to the anxiety symptoms and focusing on internal sensations in your physiology. Psychological factors also contribute to the maintenance of panic disorder. In addition to anxiety sensitivity and focusing on these internal sensations, avoidance of certain situations or activities and using safety behaviors to minimize these anxiety symptoms can also all contribute to keeping panic disorder going. Medication can help to alleviate some of the symptoms associated with panic. Cognitive behavioral strategies have also been very effective in helping people to overcome panic disorder. And this includes targeting the thoughts and the cognitions that fuel the maintenance of panic. Addressing these behavioral aspects as well, such as your avoidance and the use of safety behaviors, is also extremely effective in dealing with panic and panic disorder. So in addition, once these strategies have been effectively used, some people may find changing their breathing patterns also helps to reduce the overall anxiety. And like I said, we'll touch on the breathing later on in the series. So it's important to monitor the frequency and the duration of your panic attacks so that you know what's going on and you know how long they last, and you can then learn to ride the wave of panic. So in the next module, we're going to look at how your thoughts influence emotions. So I want to say thank you for listening and thanks for joining in. If you like it, please add some comments. If you've got any questions, feel free to drop me a line. And yeah, we'll chat again tomorrow. Thank you. Have a lovely day.